Hi everybody and welcome to week 3. It's nice to see you all. This week is about navigating the medical world, and I've really put this together because I have a number of clients that come to me and suggest that they've gone to see their GP because they've felt a little bit depressed and anxious, and the GP has all of 10 or 15 minutes with them and may or may not do blood tests or further investigations, and sometimes the GP only offers the person an antidepressant, or for some women it's been the contraceptive pill, and people haven't found particularly like they've been able to actually work a little bit more about what is going on with them and what else they can do, or what else they might be able to ask from their GP, or what services might be available to them. So I thought I'd put this week's talk together to talk about navigating the medical world, what you can expect, what blood tests might be done, what to look for, what's normal and what's abnormal, and just hopefully this will help you when it's time for you to seek help if you do suffer from depression or anxiety. So the topics we're going to cover tonight are blood tests, how to interpret them and what are their optimum results, conditions and medications that are linked to mental ill health, when might antidepressants or other medications be helpful, and alternatives to medication. So what else works apart from medication that your GP might prescribe, and also about getting more help. First and foremost, it's really important that if you do suffer from depression or anxiety or any other form of mental illness, that you do go to your GP for a complete checkup, request a full examination, request blood tests, which I'll discuss about a little bit further on. Get your blood pressure checked, get your thyroid checked, perhaps some hormone levels as well, because these can certainly affect your mood and well-being. It's really important to rule out any physical causes contributing to how you feel. The medical world has quite a narrow view of illness, and what I mean by this is there are many sort of blood tests that you could get done, and because you are within the normal range, you're considered to be not unwell. Whereas it could be that you're only 1 or 2 points off being unwell, but because you're within the normal range, the GP will just say, look, you're tested normal, it's fine. And I've had this experience myself where I've felt very tired and fatigued, and I've gone to the GP and I've had my blood tests, and I always request a copy of my blood test because I always want to have a look and actually see what's going on. And I received a copy of the blood test in the mail, and the GP signed it and said all your blood tests are normal. And when I've looked at it, I've seen that my ferritin is 21, which is only 1 point above being abnormal. So for me, I'm like, well, it might be within the normal range, but I believe that this is what's actually causing it. It's right on the fringe. And really, ideally, for ferritin levels, you want them at least about 30 or so. Actually, you should probably have them a little bit more. But so it's really important to actually start to understand what might be normal or what might be optimum for you, and also ask for your blood tests. Have that interest to actually have a look at your blood test yourself and actually see what's within normal or abnormal range. And also some GPs will have access to free counselling service, so check and see if this is available to you. Other services may need to be paid for, but just see what the GP has. Most importantly, you are not alone. So if you do suffer from depression or anxiety, remember that both depression and anxiety are very common illnesses that people suffer from. Many people do suffer and get better. And the other thing I want to mention is a little bit about suicide. I'm not going to talk about it hugely in this forum, but suicidal thoughts occasionally when you're very depressed, can be considered normal. But from my point of view, it really is a sign that things are not good and you should seek help. And so just something to really consider. If you've got regular thoughts of not wanting to be here, life is not worth living, anything like that, it is a sign that you need to go and see your GP. So please don't hesitate to book an appointment. Your GP is a very safe place to start if you're suffering from any sort of mental ill health. So these are the common blood tests related to mental health or mental illness. And B12 and folate, I will talk about a little bit together. They're tested together, they've got a close relationship with each other, and so they're very important factors when it comes to building neurotransmitters and also for building DNA. So we know about folate for women when they're pregnant and they need to be taking folic acid because it's involved in DNA and cell growth. And I did find some research that suggested that approximately half of New Zealanders, only half of New Zealanders are meeting the recommended dietary intake for folate for adults. And so folate deficiency is relatively common in depressed people. And there was also some studies that found that people who are have very low folate and are placed on an antidepressant may not respond as well if they've got very low folate levels. So something to be checked, and I think it's a really important test. B12, there's some relationship between B12 and depression. It is involved once again in DNA synthesis. It's very low levels can be related, can contribute to depression and also anemia as well. And anemia can affect your energy levels and sleep and mood. There is some confusion about some blood tests, which makes it really difficult to interpret. Sometimes they're not the best markers. The body's very good at keeping homeostasis, so good levels of things, but it may mean that your cells are not actually getting the right amount of nutrients. I did find some studies that suggested that vitamin B12 supplementation with antidepressants significantly affects improves the depressive symptoms when they are taken together with the antidepressant. This is about testing your thyroid. So that TSH is your thyroid stimulating hormone. And quite confusingly, TSH is not actually produced by your thyroid. It's produced by your pituitary gland in response to circulating thyroid hormones. So I'll talk about this and I'll go through a slide. Hopefully I'll explain it a little bit more clearly. But the thyroid produces hormones which support and regulate metabolism in the body. And so incredibly important for just about everything about how your body runs. And so a TSH is a very common blood test that your GP will use to look at your thyroid function, even though it's not actually a hormone produced by your thyroid gland. Ferritin is about iron levels, so low iron can be associated with poor sleep, low energy, low mood, and iron is necessary for neurotransmitter production as well. There were some studies, I think I mentioned them earlier, that low serum iron is found in people with schizophrenia and depressed people. There are other blood tests that you can get. You can look at your cholesterol levels. I will talk about this a little bit because there is some association between very low cholesterol levels and depression. And there's also cortisol. Cortisol is a stress hormone. So your GP may decide to have a look at your levels of cortisol in your body, but they're not usually looked at when it comes to mental illness in general. So this is a little bit of a diagram that I put together for looking at what is TSH, so the thyroid stimulating hormone. And obviously this lovely picture here, this isn't the perfect brain and these aren't in the right places, so do ignore that, but hopefully you'll get the idea of what I'm referring to here. Excuse me. So we have the hypothalamus, the pituitary gland, and the thyroid gland is this little butterfly shaped gland at your level of your throat. So the pituitary gland actually sends a message to the thyroid gland, and that message is in the form of a thyroid stimulating hormone, and it tells the thyroid how much thyroid hormone to make. The thyroid then produces T3 and T4. It produces more than just that, but for this evening I'm just going to keep it really simple. it produces T3, T4, which are the hormones that speak to the rest of the body and the organs about how fast to work and general metabolism in the body. Now, the levels of T3 and T4 are measured in the blood by the hypothalamus, and the hypothalamus gets these readings and then will say to the pituitary gland, you need to send more or less thyroid stimulating hormone depending on what the levels are. So for example, if your thyroid hormone levels, your T3 or T4 levels are very high, this will get a response to say the hypothalamus will be getting high levels, and it will say to the pituitary, please reduce your thyroid stimulating hormone because the thyroid needs to make less thyroid hormone. The other way around, if your T3 and T4 levels are very, very low, the hypothalamus will get the message that there's not enough levels in the blood, and it will tell the pituitary to please make more thyroid stimulating hormone to increase the thyroid production from the thyroid gland. So a low TSH reading suggests you have high amounts of T3 and T4, and a high TSH reading suggests that you have low amounts of free T3 and free T4. The F just stands for the available hormone. So this is a really important test, I think. I think many people do suffer from mild hypothyroidism, and I think it's a really important one to get checked. So when we're looking at thyroid hormone levels, generally medically, I think they like it between 0.5 and up to 4. When we look at it for optimum levels, we usually look that we would want them between TSH between 1 and about 2.5. These are optimum levels. So if we were looking at exactly what we think would be best. They can vary at times of the day and all that sort of thing. So just a slightly above or slightly below is no reason to panic, obviously, but this is the sort of things that we would look at. And just a brief note of, I've discussed this before, that the thyroid needs iodine and selenium, amongst other things, but very, very important for its ability to produce the hormones that it needs to. This diagram shows how important the thyroid is. So everything, breathing, heart rate, nervous system, body weight. So hypothyroidism, generally you slow right down. So when you have a low thyroid function, everything in your body slows down. So you're likely to put on weight, you're likely to get a little bit constipated, your body temperature reduces, everything slows down. When you have hyperthyroidism, everything speeds up. And so you're likely to feel anxious. Your breathing is a little bit faster. You won't sleep as well. You tend to lose weight. You may get diarrhea, for example. Really, really important thing to be looking at, and something that I think that should be checked if you suffer from depression or anxiety is one of the first things I look at. So other not so common blood tests, zinc and magnesium specifically are very hard to test in an ordinary blood test. And because the body, once again, is so good at keeping levels looking regular, even though the cells might be getting a little bit deprived of some of these minerals. So zinc is, if your GP chooses to do this, most often they won't. Anything less than 7 would definitely be indicative of a low zinc overall. Magnesium levels should be about 0.9 and above. Once again, not maybe the best test in accuracy, but if your GP chooses to get that, that would be fine. Vitamin D, this needs to be self-requested. It does usually cost money. It's important also because vitamin D we think of for osteoporosis and bone health, and for sure that is very important for bone health, but it's also important to reduce inflammation in the body. If you've got very low vitamin D levels, it is associated with depression and also general inflammation in conditions such as arthritis. So ideally you want vitamin D level of about 80, so this is optimum. Medically, below 50 would be seen as deficient. C-reactive protein is actually relatively common. It's not always done for depression or anxiety because it's a marker of inflammation. So CRP stands for C-reactive protein, and it's just that it would be an interesting one to see if there is inflammation happening in your body. Inflammation is often associated with depression. Of course, inflammation could be from just about anything. You can sprain your ankle and you'll get inflamed and you might get a raised CRP. So you just have to think about that one clearly. If it's raised regularly and chronically, we suggest that there would be some more longer term inflammation going on in the body. Other conditions associated with mental illness. So I've talked a little bit before about irritable bowel syndrome and inflammatory bowel disease, IBS and IBD, and there is a really strong correlation between these and depressed mood or anxiety. So there are some studies that suggest anything from 50 to 90% of people with IBS to IBD also suffer from ill mental health. And it's an important thing to discuss with your GP. If you've got bowel problems or gut problems, there could be a bidirectional relationship. Sometimes if you treat what's going on in the gut, the depression will go away or the anxiety will go away. Other times if you manage to treat the depression or anxiety, sometimes the gut symptoms will subside. So just really important to acknowledge that there is a really strong relationship between the two. I've talked about thyroid, hyperthyroidism, hypothyroidism. There's also Hashimoto's and Graves' disease. These are two autoimmune diseases that affect the thyroid. I'm not going to go into those tonight, but just to let you know that they exist. Chronic stress. I'm going to talk about this a little bit, and it seems a bit odd to put this here, but many people may present, and I often suggest that this is sometimes a man thing because it's a bit of a generalization, but they might be less willing to talk about their feelings, but they may present with stress-related symptoms. And I'll talk about what these could be and why this might impact on your mental health, but also why it might impact on your physical health, and why it's important to understand the relationship between stress and physical symptoms. When you are chronically stressed, your body doesn't put so much energy into the basic everyday things like digesting food and making sex hormones. It actually spends too much time making sort of adrenaline and cortisol, the stress hormones, to just, for ready for the fight or flight. And some of the other conditions that are related with mental illness, I've mentioned before, the high CRP, very low cholesterol level is found. So some people that have very levels of depression. I think one study suggested irritability. I'll talk about this in a little while. Have very low cholesterol. Hormonal abnormalities, hypochlorhydria, so low gastric stomach acid. Celiac disease specifically because you can get almost like a malnutrition due to not being able to absorb nutrients from having a bowel that might be quite damaged or inflamed. Autoimmune disorders, I think I've discussed those before as well. Heavy menstrual bleeding, dry eyes. It was very interesting. I found a study from ophthalmology that associated dry eyes and depressed mood. Now, interestingly, dry eyes can be treated with omega-3, so perhaps there is a relationship between the depressed mood, being low in omega-3 fatty acids, and also having that symptom of having dry eyes. And heart failure. Something like 30% of those that suffer from a heart attack go on and get depressed afterwards. I'm not sure what the relationship is, but there is definitely a relationship there. So a little bit about long-term chronic stress. So this can arise from either a physical stressor, so a chronic pain condition, for example, or a mental stressor, so a bad relationship, job that you really dislike, anything that is in your life and that's a chronic, ongoing stress. It places the body and mind on high alert. It reduces the production of stomach acid and digestive enzymes. So I talked about this, I think, in week 1. You're less likely to get all the nutrients from your food if you're not able to break the food down well. It can cause HPA, HPT dysfunction. So the HPA, remember when I talked about the thyroid and I talked about the hypothalamus speaking to the pituitary gland, which spoke to the thyroid gland? Well, the pituitary gland also speaks to the adrenal glands and speaks to the ovaries and the testes in men as well. So if you have chronic stress, these messages, this message system can become quite disrupted. And you find, for example, if you're thinking about adrenal glands, if they're constantly putting out very high levels of cortisol, what can happen after a while is that the hypothalamus starts to ignore those messages because they're high all the time. And it starts to reduce the output of the flow of hormones down this cascade. So this can have long-term, ongoing consequences. Obviously, long-term chronic stress can contribute to chronic pain from muscular tension, can cause high blood sugar levels. So I think if you listened last week, there was a situation where one of the clients had a very distressing email and noticed that her blood sugar levels had shot up. So if you're getting this time and time again, this chronic stress, because your body's getting ready for the fight or flight, you might find that you're getting high blood sugar levels regularly. That can cause chronic, obviously, people think about pre-diabetes, and it can change your immune system function. So there's a little bit of a diagram here that looks into this a little bit more. We've got a perceived alarm, whatever that might be. That might be a near miss on the motorway. It might be simply being late for work. It might be an argument with somebody. You'll get the release of the cortisol and the adrenaline from the adrenal glands. It sends messages all through the body to get it ready for fight or flight. So you're getting an increased heart rate, an increase in blood pressure, increased sugar in the bloodstream. You can get an altered immune response. So your body is producing all these things ready to support yourself if you get injured, basically. So it produces blood clotting factors. So if you think about people that might present to their GP with some of these symptoms, increase in blood pressure, increased sugar in the bloodstream, getting sick regularly. For some people, there's this risk of strokes. For if you're getting increased blood clotting, this is the relationship about how stress might produce some of these symptoms. So here you've got like a mental stressor producing physical symptoms. But that might be what somebody goes to the GP for. They might go for physical symptoms and not actually, I'm feeling stressed or I'm not happy. It might be going to look at, my heart rate seems fast, or I don't feel so well. They find that you've got high blood pressure, for example. So what's supposed to happen is that the threat, the perceived threat abates and you return back to a baseline, which is your normal levels. If this threat is continued, and for some people that have very stressful lives, this kind of cyclic thing continues. You're constantly getting this release of cortisol and adrenaline. You're constantly getting this change in biological factors in your body, and this can in turn can cause long-term chronic physical problems. So I'm going to look a little bit about some of the medications which might contribute to depression or anxiety. So this is very interesting. So this is everyday medications actually that you may or may not have used, or you might have family members on, and the research is a little bit mixed about some of these, but I certainly know that it is an individual thing.